everyone. This is Cole from the American Journal of Healthcare Strategy. I am joined here with the Administrative Fellow from Jefferson Health in New Jersey, Myrna Brignol. Myrna, why don't you go ahead and introduce yourself?
Yeah, so hi Cole, pleasure to be here with you. My name is Myrna Brignol, and I'm currently the Administrative Fellow here in Jefferson Health's East Region, primarily based in our Washington Township campus. And I received my Master's of Health Administration from the University of Pittsburgh.
I'm always happy to be able to talk with a fellow Jeffersonian. I think that's what that's how they pronounce it. And then, so you came from the University of Pittsburgh, which I'm really interested to hear about because I've actually been looking maybe potentially to move to the Pittsburgh area. So I have some selfish reasons for wanting to interview you. So you got your bachelor's in biology first, right, at the same college?
Yes, at the University of Pittsburgh as well.
And what led you to get the bachelor? Was it originally like pre-medicine, pre-nursing? What was your thoughts?
Yeah, I definitely was first on the pre-med track. And it's funny because it's what I envisioned, for my life ever since I was younger.
Mhm.
And it wasn't say my junior year of college, I was like, is this really what I want to do? I wasn't really at all like my heart wasn't completely into, say, like the hardcore science classes I was taking. Like it was just really, it seemed like a thing that I was just checking off my list and not what I was really passionate about. So it wasn't until I learned about health administration that I was like, okay, this might be more up my alley because I was always involved in, like organizations at school. I loved leading organizations. I was president of my sorority my senior year. So I just like working with people and just working with a bunch of people from different backgrounds as well. So I was like, I always knew I wanted to be in healthcare. So I was like, how do I marry in my interest with wanting to work with people, but also being on healthcare, being in healthcare. So that's what led me to health administration. And I would say it was a good choice because I'm really enjoying what I'm doing.
Excellent. Yeah, I think that that's a similar start to myself. I was very kind of dead set on pre-med. I got my first job as a medical assistant, and I said, patient care is really complicated and not exactly what I wanted to do. I joke with some of my doctor friends, and I'm kind of honest in some ways that some of the classes were just too hard for me, to be honest. And it's funny because some of the process improvement classes are too, like very challenging for them. So it's great to kind of find where your skill set is and then just go with that. And so you said from early on you were doing lots of leadership. When did you discover and how did you discover healthcare administration?
Yeah, so it wasn't, I would say, when I was really thinking of what my future would look like when I was a junior in undergrad, it wasn't until I actually had an older sister in my sorority who was a fellow at Cleveland Clinic at one point. So I was just like, oh, like what does it entail? And I did, Google researches and everything. And then I just found out that through health administration, you really have a wide impact on the healthcare industry. And, it's just not that one-to-one patient care. You really have an impact on a bunch of patients' care. So I was like, this might be something interesting for me because like I said, I always knew I wanted to be in healthcare, but it was just figuring out the capacity that I would be involved in the industry. So I connected with that soror from my sorority, and she just told me about what it really entailed. And I just felt like it was for me. So
Excellent. So early on, the connections were already helping you to kind of find information out. And then why did you choose then to get your MHA at the same university? What did you like about University of Pittsburgh?
yeah, I would say two reasons. So the main reason why I went to the University of Pittsburgh in the first place is because I was pre-med and I know that Pitt is a very strong pre-med school because of their connections with UPMC. So I
Mhm.
was like, that is very interesting to me. And I knew in order to be in the field of administration, that connection with the health system would probably also help me go very far as well. And I also really liked about Pitt is that they have an internal residency matching program. So instead of having to compete with, say, a bunch of MHA students from across the country, you're just really going head to head with your classmates for a select number of residencies. And you're guaranteed to also get a residency because it is a graduation requirement.
Excellent. Okay, so you did go for the program that had that graduation requirement. And so with that requirement, I know some students have said they didn't want a program that had that because they wanted the freedom to kind of choose whatever. And some students like yourself have said that they sought that out.
Yes.
What was your reason going into it that made you think that you really wanted a residency?
Yeah, it's really because I wanted the experience. Since primarily I was pre-med, I wasn't doing anything really outside of, say, my extracurriculars I was involved in undergrad. I wasn't doing management projects, or I wasn't involved in management of a health system or programs or that sort of thing. So I just really wanted to make sure that I was getting as much experience in the field as I could in undergrad. So, or excuse me, in grad school, so that I could, pursue my career moving forward.
Excellent. That makes a lot of sense. So I guess I kind of want to figure out how things have been geographically for you. Did you start off living in Pittsburgh, or what side of the state are you originally from?
Yeah, I'm originally from Jersey. So,
Oh, okay.
yeah, so I'm from Jersey, and then I went to Pitt for like 6 years for undergrad and grad school, and then now I'm back in
And
Jersey.
now you're back. Okay,
Yeah.
that makes
Mhm.
sense. So, how was it going to Temple? How did you enjoy that experience?
Yeah, it was awesome. So it's interesting because, with the UPMC connections, a lot of people think that primarily our residencies are with UPMC, and that is the case. But I was lucky and fortunate enough to match with Temple, and I ranked them first when we did our whole matching process because they were the only residency that had a financial operations
Hmm.
experience. So I told myself, I have no idea what financial operations looks like in a health system. So this is going to be my time to learn. So so that's how I ended up with the Temple residency program. And it was awesome because I was fortunate enough to have a hybrid model. So during the semester, I was in Pittsburgh doing remote work. And then during the summer, I was able to come home and just commute to Philadelphia, which was awesome.
That's great. I think that's a really smart way of thinking about it as well. I chose the MBA because I did my bachelor's in healthcare management. So I understood the healthcare part a bit. And I wanted to do something that was like really different and not really healthcare related so that I could get that management and finance understanding. So that's great. And how did that finance piece work? Did you gain a lot of knowledge during that about finance?
Yeah, for sure. My preceptor was actually the CFO at the time of Temple,
Nice.
Nick Barcelona. So I worked directly under him and his financial operations team, which included business intelligence, revenue cycles. So I really was exposed to a wide array of projects that fall into the financial operations realm, but it wasn't like I was just sitting there cranking out Excel sheets and crunching numbers. I was learning what revenue cycle was, which is a major part of healthcare systems that I feel like people sometimes neglect because they're like, what even is that? But it really is the flow of how money comes through the system, how it goes through, and how, we use it to advance our missions in each organization. So thanks to Temple, I was able to get that experience and also learn a bit of the business intelligence side as the hardcore financial operations
Mhm.
side of it with, the Excels and looking at numbers and that sort of thing.
That's great. That sounds like a really fun experience, to be
Yeah,
honest.
it was awesome. I loved it.
Revenue cycle, I feel like is hard to learn from a book. I've had a really hard time grasping what revenue cycle is. It's a weird term to me, revenue cycle. But once we had to start doing like some projects in class, I start to understand a little bit more. But I still would like to have that experience that you've had in terms of actually working with someone who's actually performing the revenue cycle or whatever the terminology is.
Yeah, yeah, for sure. Because you literally, like, I didn't really learn much about revenue cycle in my program. So it was like, I felt really the opportunity for me to learn what that actually means in the real world. So yeah, it was awesome.
So then after that, you of course graduated your program, and then after you graduated from Pitt, or what I was going to actually ask is, when did you start applying for a fellowship? Before graduation, after? What does the timeline look like?
Yeah, so I began applying to fellowships October of my last year in the administration program.
So the October of your last, when was your last year? 2023?
2023. I graduated in 2023, so October 22 is when
Okay,
I
October
started looking. Yeah.
22. Okay, so and then how many did you apply to?
So I feel like I was an anomaly in the fellowship process because I only applied to two. So
Oh, that is unusual.
yeah, yeah, yeah. I only applied to two, and I was like, these are the ones I want to go to, and I see myself in. So if it's meant to be, it'll be. If not, I'll figure it out.
And then did you receive interviews at both?
Yes, I did. I was.
Okay, so I guess about that question, you've kind of been 8 months into the fellowship, and is it a 2 year or a 1 year fellowship?
It is a 1 year fellowship.
Okay, so you have 4 months to go then, or so, give or
Yes,
take.
yes.
So do you want to stay with Jefferson after?
Definitely. Like
Really nice.
that is my number one plan right now, to stay here.
That's
Mhm.
great. I've heard from some fellowships at different programs. Yes, they want to stay. Some have said absolutely not. So with Jefferson, I have heard mostly people say that they do want to stay. But what is your reason for wanting to stay with Jefferson?
Yeah, and it's actually interesting you bring that up, because the reason why I wanted to do the Jefferson Fellowship was because I saw how many fellows they retained, which is, not like you said, it's not really usual for fellowship programs to really retain like most of their fellows year after year. So that was one reason why I definitely wanted to come here to the Jefferson Fellowship Program. And the reason why I want to stay now that I've had experience here is because Jefferson is going through a time of growth, and they are really looking to, I would say, foster and teach future aspiring healthcare leaders on what really it means to be in this industry. And I really appreciate that, because the leaders I'm working with, it's just not like they're giving me tasks and it's like, okay, get this done and cool. Like, they're really ingraining me in the beginning of a lot of cool programs that we have here. So I really appreciate, the time they're taking to invest in me. So I feel like it is only right for me to also invest back in the organization.
That's beautiful. That's great. I've faced really good support from Jefferson as well. Definitely different. I don't know what your background is personally. My parents are blue collar HVAC technician, many years ago, and then a school teacher. And so
Hmm.
I was not familiar with the corporate world at all. And I was told to start, getting connections. So I sent, an email to Bally, and, he's like, oh yeah, I'll meet with you, and an
Yeah,
email to, my SVP. And so it's just a different culture than what I had expected going into it.
I agree. I
So it's
agree.
nice that you've had similar experiences too. That's
Yeah, and I guess that just speaks to really the culture here and what they're trying to do. Like, one of the main things they always drive home with their strategic priority is to really invest in their talent, and it's not just words on paper or a nice thing to say in a presentation. Like, the leaders here are really taking that seriously, and I really appreciate that.
I know Temple is in a bit of a different area of Philadelphia than kind of New Jersey is, right? Were you at Temple in North Philadelphia?
Yes, I was.
Okay. How did that kind of population and the way that hospital operated, did it give you any special skills that you've then applied to the New Jersey area?
I would say for sure, because Temple has to do more with less. So, with a primarily Medicaid population, the reimbursements they're getting are like 60 cents to the dollar,
Mm.
compared to, say, commercial payers or even, say, Medicare in some instances. But usually it's primarily Medicaid. So, one thing that I thought was so valuable in my healthcare experience moving forward that I will never forget, that Nick and the team at Temple told me, is that every little thing matters. Everything you do is going to add up to a greater good. So just don't, overlook the little things. Like, if you could save $1 here, if you could make an improvement here, it's always going to matter. So just don't overlook the small things. And I think that is what I have brought into my fellowship here with Jefferson, is every little thing matters. No matter, and I just have that mindset just in life. Like, it doesn't matter if I'm just walking down the street and I smile to one person, or I just say hi to, someone across the street. Like that, every little thing you do in your everyday life really does matter. So just keeping that in mind when you're really working in healthcare too, that you might have a patient that comes in and they're having the worst day of your life, and just even saying hi and smiling to them, they could really remember that for literally the rest of their life. So yeah, so I think that's one great lesson that I learned from Temple, is that everything matters, every little thing matters, and to try your best to really not overlook anything.
That is really good advice, and I appreciate how you frame it positively as
Yeah.
well. Everything you do matters, but for the good. I know that there's that illustration of the government spending $1 billion on pencils a year, and
Right.
you can go the negative way, but the positive way is excellent. So I love that. Now you're getting close to the end of your fellowship. Are there any? We'll start with the kind of the short term. Are there any departments or roles or things you want to do post fellowship that you're looking forward to?
Yeah, so it's interesting because I'm getting that question a lot, and I could genuinely tell you I have no idea. Like, I in my head I don't have a certain role that or title that I would want. I just know what I want to do. So, I would say a lot of my time with Jefferson thus far has been really, doing business development, looking at data, looking at how like strategic thinking and just not only strategic thinking but really learning how to operationalize plans. So, I would love to do that in my future role to really start programs and get them started and really see them through. So I hope that answers. But
No, that
whenever
really
anyone
answers it.
asks me, I'm like, I can't tell you what title I have in mind. I just know what I like to do. So hopefully, something comes my way that aligns with that.
I think that's a great description. And then, is it the same way for the next 20 or 30 years down the road? You're kind of letting that be an open.
I am, yeah,
That's
yeah.
great.
Because and when you meet with a lot of leaders, they tell you like SVPs, VPs, presidents, they're like, if you asked me if I was going to be here 20 years ago, I would probably be like, oh, really? Like, that's so cool. Like, go me, because they never had that in their minds. It was a series of yeses. That's another thing that I've learned talking to leaders. Like, they're like, I got to where I am today is because I just said yes to the opportunities that were presented before me. So that's how I'm kind of framing my mindset when I think of my career journey. I just want to learn as much as I can and just really be effective as I can. So I would say that's really where I see myself 20 years down the line is just I know, and I always say this, even when I was applying for fellowships, that I want to be a well rounded healthcare leader.
Mhm.
So, whatever experiences I can do to get there is what I'll do.
So you focus on the core principles of leadership and being well rounded, and then kind of let things take you. And it's funny because when I was 18 or 19, in high school, it's like such a pinpoint. You keep bouncing from pinpoint to pinpoint of what you want to do, and then as we go through school and we get more experience, it becomes like a kind of just a category, a general category. I want to be good at something in healthcare.
Right. No, yeah, literally. It's like whatever I could do and be good at, sign me up.
Yeah, I love that. I love that. So you've provided excellent advice so far, but are there any specific points that you want to give advice to? I think one of the target audiences is people who come from fellowship programs. They're trying to get into an administrative fellowship. Are there any advice you have for them on how they can shape themselves during their MHA program, during their fellowship, to turn themselves into this great, healthcare leader that you're becoming now? Are there any things that you've done, any tips that you have?
Yeah, I would say I think I have like two main things now I think about it. The first thing is don't be afraid of challenges
Mm.
because you're not going to get better, you're not going to develop yourself if you're sticking to what you know. That's no way to grow. So that's one thing I established right off the bat. I was like, I'm not going to be afraid of challenges. I'm going to embrace everything that comes my way and try my best because that's all I could do at the end of the day. So you could even see that with the experience that I spoke about with the financial operations residency at Temple. I did not have to do that. I could have just went a normal operations route and called it a day, but I was like, no, I'm going to challenge myself because in order to be a leader, you need to have an idea of what financial operation looks like, how you deal with money, how you work the money to get you in your program to where you are. So that's one thing I always say to people is embrace challenges because you never know where it could lead you and you never know what you could learn. And I would also say it's really important. I feel like everyone always says this, but it is important to make connections because I feel that the reason why I ended up in a fellowship is because I really sought out people's experiences. I sought out making connections with people that were past fellows, even leaders that I knew. I just reached out. Like, I really reached out to everyone and to get an idea of really what being in an organization like this would look like.
Mm.
And that also goes back to making connections where you currently are. So at Temple, I formed very great relationships and connections with the people I was, working with and reporting to. Yeah, so
Yes.
I would say those three things. So make sure you're stepping out of your comfort zone and challenging yourself, making connections with where you want to be, and also making connections with the people who are around you.
How did you get comfortable making connections? For me, when I started, even now, one of the only ways that I've found is if you kind of picture the scariest person to meet with, I've tried to meet with them. And then after that, everyone else becomes easier. So, if I can meet with Dr. Cashone, and he likes me, then everyone else I think is,
Right,
is
right.
going to be okay. But, how did you do it? How did you start off and how early did you start making connections too?
Yeah, so I would say honestly, with making connections, the way it's say easier for me to just be at conferences and just walk up to people like VPs and be like, "Oh, hey, like my name
Yeah.
is Myrna, like nice to meet you," and just start picking their brains. Is you have to really remember that even though you said, we're just starting off in our careers, they started where we were too. Like they were us at one point, and they just have more experiences than we do. So it's just really just keeping that in mind. And everyone's human too. Just because they're a higher level than you are doesn't mean they're like superhuman. They're human just like you. They were at your position at one place. Like they were sorry, I'm getting tongue tied. They were in your position at one point, and yeah, so just see this as a person that you're just forming connection with, and not only are you wanting to learn about them and learning from them, they're here to also learn from you, because even though you're young and starting out in your career, you are valuable, you have insights, and you have life experiences that you can bring to the
Hmm.
table as well.
And I think that's good about the conferences. That's a good point about that. And, I always get very worried about that because, like you're saying, I don't know what I have to bring to the table. And at these conferences, I feel very awkward. I walk up to somebody like, hey, it's
Yeah,
kind of weird,
yeah,
but it's amazing because there's people who all I've done was exchange a business card with at a conference, didn't really, have a conversation that I felt like I was, being very sociable in.
right,
And 2 years later, I connect with them and we do a project together, we have a role together, and that bond is remembered fondly from the conference, and that's
exactly,
amazing.
yeah,
It's
yeah.
just recently I interviewed Scarlett from the University of Scranton.
Hmm.
A couple of weeks later, we're on the ACHE and she joined one of the committees I was on,
Look
so
at
it's those
that
weird
small world.
connections.
Yeah, yeah,
Yeah,
it's
it's
a very small
unbelievable.
world. Yeah, and like you said, it's just putting yourself out there, because I also always think if I feel awkward, other people feel awkward too.
Yeah.
So let's just be awkward together.
That's what I gotta remember. That's because I do. I feel very awkward.
Yeah,
I
yeah.
don't know what to say or what to do, and
Yeah, and it's just awkward, but I'm like, you know what? This is not a unique experience. Everyone is feeling awkward. We all have to do it. So why not just embrace it head on and just see where it goes?
I have a kind of a personal question too. I have two personal questions. The first one is: are there any conferences that you went to that you recommend?
Yeah, so one that I've gone to on a regular basis, I would say, is the HFMA, so the Healthcare Financial
Really?
Management
Okay.
Association. They have a women's conference every May. So it's awesome because it's a smaller group and it's very intimate. And they invite a bunch of leaders, not only just financial leaders, but they do invite healthcare leaders from the area to, sit on panels and speak. So that I've been going to that since I started at Temple, because that was how I kind of started getting involved in HFMA from one of my mentors that I met during my
Mhm.
Temple experience. She told me, she's like, you should come to this conference. It's great. And I was like, okay. So I've been going for the past, I would say, like 2 years now. So the one
Nice.
coming up would be my third one, and I'm looking forward to it. So I would say that's a really great one. And you have your ACHE
Yeah.
conferences as well, which are awesome. I went to both of them, two of them during my time at Pitt, which was great. And I also go to the NOFC conferences. I was fortunate enough to be on the case competition my last year at Pitt. So I was on that case competition and we competed and went to that conference, and that was amazing. So I would say those are definitely great. And yeah, even if you're a person that networking is really intimidating, start off on the smaller ones. Like the women's conference is on a smaller scale, so it's definitely more intimate, and it's easier to just walk up to people and just strike up conversations.
Yeah, very good advice. Very good advice. And then with the HFMA, I love the HFMA. I'm a big fan of them. Do you know Amanda Burridge?
That name sounds familiar.
She's the CFO of Roxborough Memorial, and
Okay.
so she told me about the HFMA and was like, "You got to get involved." And I was like, "Oh, I don't know," and then I did, and their learning materials are excellent.
Yeah, yeah, they're
Yeah,
amazing. And they also have a mentor mentee program there
really,
as
I got to
well.
look into that too.
Yeah,
Nice.
so I'm in that actually with my mentor from from Temple, the Rev Cycle,
Yeah.
Anita Cologne, the Rev Cycle VP. So we're like mentor and mentee in that program now as well.
Excellent. That's very
Yeah.
cool. That's very
Mhm.
cool. How does, and I'll let you go. I don't want to take up more than half an
Yeah,
hour.
no, it's fine.
How does the weather compare Philadelphia, New Jersey, and Pittsburgh?
So it's interesting. Pittsburgh, when I was there, it didn't snow a lot, but it gets very, very cold.
Okay. Colder
Very
than
cold. And I don't know if a lot of people know this, but it's the second rainiest city in America right after Seattle. So it rains a lot in Pittsburgh. A lot. So if you're used to, it rains a lot. So if you're used to, you know, sunny days and the snow here, you're not going to get that. You're going to get rain and bone-chilling coldness.
Oh, no. Okay. Yeah, I'll cross that off. I mean, I don't know. UMPC seems like a cool place to work, but for me, I really do care about the weather. I like the snow.
Yeah.
You know, so,
yeah, you're not going to, it does snow, but usually, I remember one year when I was up there, it snowed like an obscene amount, and everyone was like, this is not normal. And I was like,
oh really? Okay.
Yeah. But I honestly, sometimes I'm here and I'm like, dang, I kind of do miss Pittsburgh, because have you been yet?
I have never been to Pittsburgh.
You need to go, because it's its own little like culture, and it has its own little vibe. Like I think it was a great city for me to start at, you know, just going as a freshman in college, like 18, just moving out of my parents' house for the first time, because it's a very good starter city. So you get a city feel, but not being like thrusted into Philadelphia or New York City. And it has a lot of its own culture. Like it has very quirky things. Like, for example, they have a pickle festival every year.
Nice.
And like, so yeah, it's just stuff like that. And the stadiums are beautiful. Like if you're a football, baseball fan, like they're right on the Allegheny River, and like when it's sunset and the weather's perfect, it's amazing.
My wife's been asking me to go to Pittsburgh.
You guys should go. I really would recommend, especially when the weather gets a little warmer. I would go to a Pirates game.
A Pirates game? Okay, we're going to have to write that down.
Yeah, go to a Pirates game. The tickets aren't usually very expensive at all, and you'll be on you'll get the vibe. Trust me, you'll have fun. Yeah.
I will. Because, I was originally from Raleigh, North Carolina.
Okay.
And then similar thing when I was, turned 18, moved to Charlotte, did my first few years of college there. And it is a nice small city to kind of live at. And it's also on the west side of the state, kind of like how Pittsburgh is west of Philly. So
right.
I would love to go and try it out.
Yeah,
so
no, you guys should definitely go. Yeah, go when it's warmer, because right now it's a little cold and it might be good, but during the summers, I think Pittsburgh summers are amazing.
Excellent. Well, I really appreciate you coming on and talking with everyone, sharing incredible insights with us, especially later after your busy work week. So we really all do appreciate it.
Yeah, thank you for having me. This is great. Oftentimes I don't reflect on really, like my past experiences thus far in my career. So this was great to kind of, just really think about how far I've come and, how far I'm left to go. So it was great.
You've come a long ways. You're definitely an excellent leader already. And I think your trajectory looks great. So
I appreciate it. I really do appreciate that.